Hi, I'm Jennifer Allen, reporting for RSNA News. I'm talking with Dr. Brad Bennett, a third-year resident at Johns Hopkins in Baltimore. We're talking about the pivot in education that occurred because of COVID-19 and how it has affected radiology residents. Thank you, Dr. Bennett, for joining me today.
Thank you.
What type of virtual learning resources provided by your attendings have been most beneficial to you?
So yeah, as we know, a lot of our learning has changed in that time period. We got numerous different digital resources that came our way from organizations like RSNA or ACR. And internally, we actually set up subspecialty conferences throughout the different days and different parts of the day. So you could stop by in like a body MRI conference or a neuro conference. And so that really checked a lot of boxes and keeping us engaged throughout the day. It was almost like one of those stories where you choose your own adventure sometimes, but there were lots of resources here.
Now, I notice you're back at Johns Hopkins. Do you notice that radiology service that's non-COVID related has kind of picked up again?
Yeah, definitely. So for about 2 or 3 weeks in the height in March and April, things really dropped off as the hospital was preparing for an influx of COVID patients, and then has slowly brought back a lot of the outpatient surgeries and imaging as well. So we've basically gone back to almost normal volumes here, and everybody is back in the hospital as far as I'm aware.
That's great. What do you think radiology education will look like moving forward? Is it going to be kind of a combination of the traditional in-person and maybe pick up some of the additional online resources that have been beneficial at this time?
Yeah, definitely. I think digital learning is here to stay. It's some of the things that I really liked are a program director conference held at noon, which brings together different educators from across the country in different programs. And I really hope that things like that stay because it gives us access to really, really wonderful teachers through around the country. So as we move back into having in-person conferences eventually, I think that some of the really top tier online resources will stay with us. And I hope that they do.
Great. Well, thank you for your time today, Dr. Bennett.
Thank you very much.
For updates and the latest scientific research, guidelines, and consensus statements about COVID-19, visit rsna.org/COVID-19. And as always, you can find more radiology news at rsna.org/news.